focusing on, excuse me, the menstrual health supplies, identifying supply side factors impacting access to menstrual health products in sub-Saharan Africa and Asia. This webinar is going to be presented by Man Global Health, which was responsible for conducting the landscape analysis. As many of you know, this idea came out of the menstrual health supplies work stream that was interested in putting together such a landscape analysis to make sure that we had a better idea of the landscape of menstrual health supplies, the constraints and barriers that were keeping products from the women in these countries, in low and middle income countries who needed them. The objective of this work was to conduct an analysis aimed at mapping the complex ecosystem that links women's access to different types of menstrual health products, locally manufactured, disposable, imported disposable, locally manufactured, reusable, different patterns of product flow, different commercial considerations, all with the aim of better informing program decision-making and better tailoring market interventions to realities on the ground. So today, we are going to be hearing, as I said, from a team representing Man Global Health that recently completed this landscape analysis, and they were going to present their findings and recommendations. It will include an overview of the complex market ecosystems that link menstruators to menstrual health products, the dominant business models supporting product access, and the market factors that enable and impede access. We will also look into a framework that will facilitate a rapid country-level assessment that informs prioritization and selection among possible interventions. With that, I will turn it over to Lucy Wilson, who is, along with Chris Jones, leading the team that conducted this analysis and will be leading us through the webinar. Over to you, Lucy.
Thanks, Brian, and thanks to all of you for being here today. I want to start with also thanking our team. We all have different roles, and you may know us in those other roles, but we came together under the consultancy firm Man Global Health to do this work. You'll be hearing from all of us today, which shows that this was truly a team effort, as it had to be given implementation during the pandemic and lockdowns in many of the countries during the period that we were collecting data. It was a challenge. Next. Great. It will also be challenging to share with you all that we learned in under an hour. I'm going to start with a high-level overview of our findings. Chris will then present the recommendations and framework that we developed. Then Nayanthara will facilitate a panel discussion with our country specialists, and each of them will share thoughts on a specific topic as pertinent to their country. And then we'll have time for some discussion and Q&A at the end. I want to note that if you want to put your questions into the chat, please feel free to do that. We'll try to answer them towards the end. Please also introduce yourselves in the chat as we go along. Next. Before we jump in, a few notes on terminology. For the purposes of this report or webinar, menstrual health products refers to commercially made disposable pads, tampons, reusable pads, and menstrual cups. These are the 4 types of products that we discuss. We also use the gender inclusive term menstruator to denote anyone who uses menstrual health products. Next. We can actually skip on again next to the project aims and process, which is the beginning of our findings. As Brian said, RHSC commissioned this work to meet the needs of the menstrual health workstream. The aim was to inform program decision-making for tailored menstrual health market interventions that are aligned to realities on the ground. We focused on supply and access, and so worked to map the ecosystem that links menstruators' access to menstrual health products and the different patterns of product flow and commercial considerations. We conducted an initial global level literature review and series of key informant interviews. That led to an initial analysis of emergent constraints and opportunities. Our country deep dives then added additional key informant interviews. We then aggregated our findings and did additional work on mapping the supply chain. This led to the development of recommendations and then the menstrual health market intervention framework, which was shared with a small group of stakeholders who provided feedback in May and June. Next. The countries that we selected for our deep dives were Tanzania, India, Nigeria, and Kenya, and we were excited to be working with menstrual health workstream members in most of those. Halima, Tanya, Jennifer, and Wawira, who you'll all hear from more later today. Next. So we'll do some top line findings and you can move on again. Thanks, Nayantara. So looking at our top line findings, I'll start with some global trends. There is enormous need and unmet need for menstrual health products. More than 500 million menstruators lack everything they need to manage their menstruation, and this equates to a quarter of the global female population of reproductive age. The market is also growing rapidly due to increasing numbers of young people, an emerging middle class, changing social norms, and swift innovation in the market. Looking at the graph shown, which shows India, sales volumes are doubling every 5 years, but still only meet about 10% of the potential sales. The urban, wealthy, and educated are the most likely to be using commercial products, and this reflects the interrelated challenges in access, affordability, and awareness that we found in our analysis. These three factors lead to latent demand and limited use of commercial products. Challenges related to access, affordability, and awareness are a theme here. The challenges exist because manufacturing and sourcing raw materials at levels of scale required for efficiency is capital intensive. There are inefficient and fragmented supply chains that limit availability and lead to high retail prices. The lack of awareness of menstrual health options, including the types, brands, and quality, also limits the actual demand and thus the supply, because retailers don't stock what their customers aren't buying. Then there's the inherent challenges with the current products that limit their acceptability, ease of use, quality, affordability, and environmental sustainability. And I'm sorry, I think we're on the wrong slide. There you go. Okay, so again, the inherent challenges with current products is limiting as well. And next slide. A few other top line findings of note. Income matters. As you can see in the graph, at a country level, higher per capita GDP is associated with higher use of commercial products. Social enterprises are proliferating and seen as promising, but they face challenges. There's also promising innovations in the area of distribution, but we feel that these need additional evaluation. We don't really know how they are working yet, especially for different products and across different markets. Finally, choice matters. Menstruators need quality products to choose among and innovations to meet their context-driven needs. One type will not fit all menstruators. Next. Okay, I'm now going to move on to the key business models that we identified and how they contribute to the market structure. So you can go next again. Great. Okay, our analysis identified 4 business models supporting upstream access, or brand owners. Brand owner business models are primarily differentiated by their size and geographic reach. The differences were also apparent in the types of products, the functions within the supply chain, and the distribution channels that they used. These distinctions present different opportunities to support investments. In general, we found that the brand owners fell into 4 categories: cottage industry manufacturers, social enterprises, mid-tier manufacturers and importers, and multinational companies. The cottage industry manufacturers are generally making disposable or reusable pads. These are sometimes micro entrepreneurs and also sometimes community-based organizations. They're often supported by groups like Pad Project, Days for Girls, and Akar Innovations, which is one of the disposable pad machine manufacturers in India. Social enterprises are making all types of products. They design and or manufacture. They may also import or outsource manufacturing. Mid-tier manufacturers and importers are the ones with names you probably are least likely to recognize, unless you're in one of the countries where they have the largest market share. They either manufacture locally or import white label brands. Finally, the MNCs are Procter & Gamble, etc. They design and or manufacture their products, and they are unique in their large marketing budgets. Next. Distribution models include traditional distribution approaches used for a wide variety of fast-moving consumer and pharmaceutical goods and reach pharmacies, grocery stores, etc. In addition, two other distribution models stood out as unique and are innovative for the menstrual health market and were consistent across countries and significant for future investments. These were direct-to-consumer distribution, which is where a lot of innovation is happening. It includes the use of e-commerce platforms and vending machines. Then there's institutional free and subsidized distribution. We found this was generally viewed favorably by most market actors, especially when it was well targeted. It provides much needed education and awareness that supports use of products. And for those brands that are being distributed, it builds brand awareness and loyalty. Next. Great, so this looks super complicated, but it's also a super simplified diagram of how products flow from manufacturers to menstruators. You can see that the four brand owner business models are on the left-hand side under the manufacturer and importer headings that are in orange. The MNCs are generally using the traditional FMCG and pharmaceutical channels of distribution. Same with the mid-tier manufacturers. They also follow those traditional FMCG and pharmaceutical importer and distributor channels. The social enterprises may also use those channels. And all three of those brand owners are using direct consumer models, including e-commerce and vending machines. The social enterprises are also innovating with non-traditional outlets, including clothing stores. And the cottage industries tend to sell directly to consumers. All four of the brand owners are providing products to governments, NGOs, the UN, and others who are doing free and subsidized distribution. Next. We're now going to move on to our main findings, which are organized by market function. The core market functions are product, place, price, and promotion, followed by our supporting functions that create the enabling environment. Next. So we start with the product function. Disposable products or disposable pads are the dominant commercial product, with global brands leading market share in most but not all countries. Mid-tier brands have the market share in some. Social enterprises, which are often those supporting reusable products, are beginning to get commercial traction, but knowledge of these products remains low. As mentioned earlier, informed product choice is really critical. Menstruators benefit by choosing among a range of options that meet their needs and allow for mixed use. In addition, a proliferation of brands includes a wide variation in quality. Our report also captures some interesting product innovations and considerations related to manufacturing raw materials, etc. Great, so on the place function, which covers distribution and access, you won't be surprised to hear that menstrual health products are broadly accessible at retail outlets in urban areas. Availability in rural areas is limited, especially for reusables. This is partially because in-country distribution of finished products through traditional distribution channels is often inefficient, but some companies are able to manage it successfully, and examples are shared in the report. E-commerce and other direct-to-consumer distribution and sales platforms are promising. Experimentations with these non-traditional approaches has mixed results. This includes distribution through sexual and reproductive health channels. We saw mixed results in the very limited scenarios where this had yet been attempted. So more experimentation is needed. And again, free and subsidized distribution, especially via schools, is an important distribution route that fills gaps. Next. So looking at price, again, we all know that menstrual health products, particularly reusables, remain unaffordable to menstruators at the lowest income brackets. Raw materials and distribution drive the costs, with import duties and manufacturing high, depending on the context and the product type. Cash-constrained menstruators may prefer to buy smaller packages or even individual pads or products, and vending machines help to fill this need. The recommended retail prices for menstrual health products are rarely adhered to by retailers, and because of those inefficient distribution channels I mentioned on the last slide. And for those of you who've been following the recent work by others done on menstrual health tax changes, you already know when taxes and or duties on menstrual health products are removed or reduced, the result is not always a reduction in price. Next. The fourth P is promotion, and this links back to the awareness challenge I mentioned earlier. It is definitely one of the biggest. Awareness of disposable pads is high, but knowledge of reusables and tampons is low, and we also just need better data on awareness. Many of the suppliers combine product promotion with school-based puberty education, which is great, but we also need to make sure it includes category-wide promotion and isn't too brand or type-centric. For brand promotion, this usually targets urban, middle, and upper income populations with aspirational messages, but unfortunately, we are also seeing negative advertising and misleading marketing claims that are becoming more prolific and problemsome. Stigma and taboos associated with menstruation challenge the market at various levels, not just for the menstruator, but for how promotion, marketing, and even distribution function. Next. Finally, our supporting functions. Where strong menstrual health coalitions exist at the national level, the support that they provide for advocacy and coordination among actors appears to be important. The development of product quality standards is growing, thanks in part to the work of those coalitions at the national level, as well as at the regional level, and in addition to global coalitions like RHSC. Standards are beneficial not only in ensuring quality products for consumers, but can also facilitate entry of new product types and brands into the market. And while menstrual health has comparatively little funding from other funders working in similar areas of health, the commercial potential of the menstrual health market presents significant opportunities to spur commercial solutions to increase use. Speaking of those opportunities, I'm going to hand it over to my colleague, Chris Jones, to share with you our recommendations and framework.
Thanks, Lucy. So our overarching recommendations, Nainthara, if we can go to the next slide, please, really focused on 16 recommendations which fit neatly into 4 overarching buckets that we use to categorize and describe these recommendations. They are aimed to reflect the reality of MH programming on the ground, which includes, unfortunately, scarce funding that exists within the sector, as well as the existence of a vibrant, if not perfectly performing market. That includes the active presence of the private sector, social enterprises, and other business models that Lucy just described just now. The opportunities to incentivize choice include development of product standards and their fair enforcement, which can ease market entry of new products and make sure that registration requirements aren't hindering the entry of those new products, which may not conform to what those regulatory bodies determine as meeting the requirements of a menstrual health product. They also include category promotion to ensure menstruators are aware of and have access to products and are available and encourage market entry of new products. Support for local market actors to grow sustainable businesses can include development of innovative financing and incentive mechanisms to strengthen local brand owners, which can address the various capital and capacity constraints manufacturers face, improved coordination between brand owners and manufacturers through industry associations or commercial subgroups, and finally, support for local manufacturing, which includes investments in updated and larger machines and molds to improve quality of production, introduce greater economies of scale closer to the markets that they serve. And we can talk a bit more about that in the discussion as well, because it's an interesting opportunity that warrants further exploration. Improving distribution to position MH interventions in the context of broader investments and innovations to expand access and distribution is important. So we know that many donors, including USAID, foundations such as SIF and the Gates Foundation, are making big investments right now in improving access to SRH products by investing in distribution channels, either innovators or existing distribution channels. And in order for for the menstrual health world to capitalize on that, it'll be important to position MH products within the context of those broader interventions to really essentially piggyback on those existing interventions or investments and capitalize on increasing access in that way. Finally, support for awareness building includes category-wide promotion and stigma campaigns or anti-stigma campaigns. Go to the next slide, please. We did aim to make these recommendations sync in and link to potential funders and essentially provide a shortcut of who might be most likely to fund and support some of these recommended interventions. So, sorry, if we look at the top line for the example here, and in the report, you can see greater information that's available. We have the development of product standards and their fair and effective enforcement is likely to be funded either by a government itself or traditional funders. The recipient or implementer of that funding could be the governments themselves or market facilitators or intermediaries to facilitate the use of those funding. And finally, the beneficiary business model would include actors such as cottage industry manufacturers or social enterprises, mid-tier manufacturers, or multinational corporations. So for each one of our recommendations, we aim to align who might be most likely to fund that intervention and how that recommendation would be implemented overall. Go to the next slide, please. So menstrual health markets are uniquely suitable for market shaping interventions. And so they are characterized by vibrant private sector participation, what we saw by multiple actors throughout the private sector, as well as NGO and social enterprises. They are relatively well targeted with free distribution and low levels of distorted donor funding, all of which enhances the need for sustainable solutions that engage all sectors and actors in the market to scale. So the menstrual health market intervention framework, which we developed as part of this work, draws on market shaping frameworks that already exist to identify interventions that address country level market constraints and build strong menstrual health markets. It is basically a shortcut to align best practice interventions to a set of country-specific variables and constraints plotted on the framework, linking recommendations to actors in the supply chain and the underlying market functions that these interventions aim to address. Its development was informed by the work that Lucy just presented, including the deep dives in India, Nigeria, Kenya, and Tanzania, and some great feedback from stakeholders through another forum that we held earlier as part of this work. Let me dive deeper into this framework as well. It is dense and somewhat complicated, so bear with me and also just recognize that the full report does describe this in greater detail. So the next slide, please, Nayanthara. So the variables in the menstrual health market intervention framework include recommendations, which are mapped against market functions, which are critical to the healthy market. And as Lucy described, those market functions include functions along the core supply chain, including the 4 Ps of marketing, supporting functions such as government agencies, assuring quality of products or services of market stewardship functions. It also includes financing functions outlining how services and products are paid for and the role that financing plays for market actors. And finally, the rules environment, which includes regulatory bodies on how products are imported or registered and taxed. Finally, informal rules such as stigma also play a large role in menstrual health markets and are critical to the framework that we developed. Those are also then mapped out against the key actors in the supply chain. And finally, the market maturity spectrum, which I'll describe right now. If we go to slide 26, please. Thanks, Nayanthara. So as part of this framework, we did find that across the markets, the assessment tool does aim to support an understanding of how a country is performing against a standardized set of programmatic elements that contribute to market maturity overall. recognizing that each one of these markets is relatively mature or developed against a set of key benchmark activities. Market maturity is comprised of the building blocks of a healthy, mature market and include on this slide, just an abbreviated form, market fundamentals, which build off the enabling environments for strong menstrual health markets, which includes the presence, for example, of an MH coalition and coordination of market actors, strength of government engagement or development and enforcement of product quality standards. Market environment includes the strength and presence of actors in the market, including social enterprises and mid-tier and local manufacturers. Market breadth and depth factors look at the category specifically itself and really focus on the 4 Ps of marketing, including price, promotion, place. And finally, the macro factors, which are not shown here, look at the bigger elements of the economy of a country that we're exploring, whether it's GDP per capita and MH commercial product use rates, which, as Lucy demonstrated earlier, can directly correlate to use of a quality menstrual health product. So let's walk through some of this against the framework that we've developed. So the framework is, as presented here, aims to support users, whether donors, investors, government, or implementers, to select and prioritize market interventions based on the relative maturity of the market and where in the value chain the market is falling short in addressing the needs of priority populations. Market maturity is assessed using the tool I just described, forms the y-axis on the left. Some of our recommendations are more appropriate for a market that is less mature, while others, more sophisticated interventions, are more relevant for mature markets. The other variables in the framework along the x-axis are the market functions, as well as key actors in the value chain, which includes manufacturers or distributors or retailers. So we mapped recommendations and interventions to the relevant area of the value chain that the intervention is addressing and how relevant that intervention is based on the market maturity. So let's go through this example here on the coordination and coalition building, which are fundamental building blocks of a healthy market, are more likely and are thus more likely to yield greatest value in less mature markets. The same goes for stigma reduction and the need for free or subsidized distribution. So interventions that target less mature markets will be on the top end of the framework. As we go to the next slide, as markets mature, more sophisticated investments are likely to require to address market failures. That includes fair and consistent enforcement of product standards, and non-traditional distribution approaches emerge as opportunities as markets mature. And finally, we get into even more sophisticated investments around encouragement of local manufacturing and new product innovation in the most mature markets. There is some sequencing to investments. So in less mature markets, we start with recommendations that impact the building blocks of a healthy market, which are up above on the left, and that are really aimed to yield benefits to all market actors. But as they mature, investments in more sophisticated market interventions are likely to take that market to more sustainable levels overall. So the slide here, if we go one more click, Nayanthara, really highlights all of the core recommendations that we've made and identified in this report, and again, provide essentially a shortcut of how a donor or investor can look at a specific market, let's say Tanzania, assess where it is on market maturity, and then design interventions based on where in the market those functions are failing. So I'm going to hand it off to Nayanthara to lead a discussion which includes presentations from each of our 4 country-specific consultants that supported our work and were critical to informing both the development of the intervention framework as well as the underlying market recommendations included in this report.
Great. Thanks, Chris. So it's my pleasure to introduce to you all our 4 consultants who supported our deep dives in the 4 countries that you saw earlier. We have Halima Lila, who worked in Tanzania. She's also the founder of Girls and Women in Tanzania. We have Wawira Nyaga in Kenya, who is a consultant, a facilitator, and coach based in Nairobi. We have Tanya Mahajan from India, who is also the co-chair of the RHSC MH workstream. So many of you will be familiar with her already, and a consultant with Development Solutions India. And finally, we have Jennifer Amadi in Nigeria, who's a consultant in sexual and reproductive health rights and a PhD candidate in gender and development studies in Nigeria. We'll start with Halima telling us a little bit about one of the menstrual health manufacturers who's a local mid-tier manufacturer in Tanzania.
Thank you, Nayantara. Hi, everyone. So I'll just put my video a bit. You can see me and then I'll go off. Hi, everyone. It's good to see you all. So I'll be discussing about Kipepeo. Kipepeo is a local media manufacturer in Tanzania. So it's a national and regional also. It imports their product in Zambia and in Comoro, but most of their raw material are imported from Europe. But they produce in Tanzania and they design and distribute here locally, but it's also some of the countries like Zambia and Comoro. So they have different products like sanitary pads, maternity pads, and et cetera. They were formed in 1982 and they launched producing sanitary pads in 1985. They have a machine which they have capacity of producing 2,400 pads per hour. And they are the most cheapest product in Tanzania, which is 1,500 shillings. It's less than $1. So why Kipepeo is not around across Tanzania, and it's even though it's the cheapest product in Tanzania and it's disposable. So I'll discuss a bit of challenges and their constraints, and then I'll also suggest the way forward, how we can kind of work together and make sure access of the product are available across our countries. So affordability, when we had a conversation with Kipepeo founder and director, she was talking about affordability. Despite having some of the most affordable products, but affordability for many women across Tanzania is still a challenge for them to access and to have and to be able to buy the products. And then there's also a challenge of lack of investment in awareness raising. And most of the producers, market oriented, it's also a challenge. Most of the people who are producing the products, they lack capacity of market. So such as branding the product size, now with innovation, many young people and women, they also love the products to be like this, like that. And then there's also a challenge of distribution channel. Supply chain is very limitation. There's a lot of, like if the product is coming from Dar es Salaam is our big city in Tanzania. And then when it's supposed to reach maybe in Katavi, where I am now, it's very challenging. It's 2 hours by flight. You can imagine you have to sleep in another town and then to come to Katavi. So the more the product is going through the trucks, the more they charge the margin. So the margin is very huge for the product. The time when the product is reaching Katavi, it will be double the price for the people who are buying in Dar es Salaam. And the capacity and the budget is a challenge for the producers. Still, they lack budget and the capacity to run the product and of course their machines, because their machines they're saying, according to them, their machines are coming from Europe. So there's a lot of renovating and checking them up and things like that. And also unable to negotiate favorable raw material prices on their own, given that quantity are limited. So most of their products also they buy from outside. There are some products which they buy inside Tanzania, but some of the products they buy actually from Europe. So the quantity might be very expensive because they can't negotiate the raw material. And then also transport costs for the raw materials. If they buy the material from outside, they also have to pay for the transportation from Europe to Tanzania. And then as Lucy and my other colleagues say, stigma and taboo is still very, very big problem in our communities. Still, majority of women and young girls are not using disposable products. They say the new product, they still use local, which they use cloth, they use tissue. There's a bunch of material which majority of women in Tanzania are still using, which when it comes to safeness is also a challenge. So we also discussed what needs to be addressed to improve access of products in Tanzania. So what we are suggesting, especially in Tanzania, need to incentivize and manufacturers who are producing locally. And then we need to create a platform, encourage local manufacturing by understanding and addressing challenges associated with local manufacturing. So sitting down with them on the table and see what are the many challenges they are facing when they're producing these products. And then direct community sales are the main promotion platform for them as they reach the community through awareness generation activity. So in Tanzania, we have different women groups, girls groups. So having direct community sales, it also might be helpful to some regions. And then huge investment in product awareness should be made. Most of the products importer or producers locally or outside, the ones who are bringing from China, most of them, they say awareness is a very big challenge, and there's a need, huge investment. There's a need of investing in awareness in the community because of taboo and stigma which is associated with modern disposable pads and pads in general. Huge investment in product awareness, of course, investment in marketing, such as branding, promotion. Branding is also challenging because many people who go to this business, they don't really understand how marketing works. And there's a lot of challenge especially to now, what is happening around across the world. People also want to see it happening in their countries. And then working close and bringing distributor and retailers on the table on how they can reduce the margin, because these are the real people who are distributing the product to women and girls across. So these are the people also need to be put in the table and discuss how can we try to reduce the margin of the product to women and girls. And then advocating and working close with the government to remove tax. So VAT in Tanzania is back, and it's back because there was a lot of challenge. The government didn't see the reduction of the product, so they decided to bring back the tax. So our menstrual products in Tanzania are tax-free. So now we are saying we need to engage and we need to advocate all stakeholders sitting on the table and see how can we remove the tax, and working close with government, but distributor, because the government also need tax. So how can we negotiate and talk to them and say, okay, you can charge this, and then distributor and retailers can reduce the product. And then also what we're realizing in Tanzania, we need to engage and work close with boys and men, because unfortunately, men are the ones who are buying the product for their women and for their daughters. So for them, we're encouraging and having the education on menstrual products and its advantage is very critical in Tanzania. And then also collaborating with giant companies like Coca-Cola, GBL, etc., because these are the people who have huge investment with trucks, big trucks, which are transporting, can be Coca-Cola, can be beer, can be whatever they have. Even they have even the places, warehouses where they put all these products. So how can we collaborate? Because where I am now is 2 hours by flight, but I'm seeing Coca-Cola, I'm seeing Pepsi, but I don't see variety of products, menstrual products. And then education and awareness of the quality of the product is also very essential. Yeah, even though we need we need all the product to be available for girls and women across wherever they are, they need to choose. Choices is very critical. But at the end of the time, quality of the product is also very critical, even though in Tanzania we have institutions who are dealing with quality of the product, but I think we need to invest more in the quality of the product for our women and girls across. So that's it for me. Thank you, Nantara.
Great, thank you, Halima, very much for sharing all of that information about Tanzania. We're going to move next to Wawira, who will tell us a bit about some innovation distribution models in Kenya. And just as a reminder, we have only about 10 minutes to get through the next 3 countries, so please do limit your inputs to about 3 minutes each. Thank you.
Okay, thank you, Nantara, and hi, everyone. I'm going to put on my video briefly so that you can see me, then I'll turn it off so that we can move this very fast. I will just give brief highlights in terms of some of the innovations that are coming up and are very promising in Kenya, and I'm going to zero in on the direct-to-consumer models. Of course, when we were doing the landscaping, we looked at different models, but then for now, I just want to zero in on that, particularly on the online and the bedding machines. So Kenya has a very vibrant e-commerce ecosystems, and this has largely been facilitated by a robust mobile money and the vast growing courier services. Most of these platforms are selling about everything, and these include the Jumias, Gigi, and MyDawa. But there's one that I want to focus on today, Kasha, which is a purpose-driven e-commerce platform. And it's a go-to place for women's health and self-care, including menstrual health products and innovation. The way Kasha works is by combining both online and offline capabilities, which allows women to search, order, and pay for menstrual health products that are very discreetly delivered to them by a local micro-entrepreneur. And when we talk about a local micro-entrepreneur, we're talking about courier services, stockists, or agents. And their unique offering to menstruators is that Kasha offers variety. I think when I was doing the research for Kenya, it's the one-stop place where I got the highest variety, of all the products, at one stop. Then they also assure quality, confidentiality, and convenience. And also what they're doing is they're making a very concerted effort to build a relationship with their customers. They really engage their customers to understand their needs and their preferences and work around to make sure that whatever they're offering suits the customer's needs. On the other side, they're also offering manufacturers and distributors a platform where they can gain insights on the users. For example, what demographic is consuming what products, their consumer preferences, desired price points, and among other things. The other model that is coming up very fast and is very promising is the vending machines. And thankfully, this is right on time because it's addressing barriers such as stigma and taboo that are associated with menstruation in Kenya. For instance, whereby a lot of women and girls shy away from directly purchasing products, menstrual products from male shopkeepers. And in other instances, it's a question of affordability. When you look at the market right now, most of the market bundles are the pads from £8 and above, and at a price of about 50 cents dollars. And this can be very high for some of the consumers, especially those that are operating within the constraints cash. So there's a local enterprise called Wiseme, and this targets menstruators that need to access menstrual health products conveniently when and where they're needed. This could be a cash-constrained menstruator, a student, a shopper, sorry, a menstruating traveler, while it's providing privacy in strategic locations such as public toilets, institutions, railway stations, or sometimes just a menstruator that is on a date and does not want to carry a bulky pack of pads. So Wiseme is a startup. It's about 3 years old, but it has a couple of challenges that are faced by most of the startups. One of it is getting manufacturers to package the products into smaller units. You see, the technology is made in a way that it can only dispense smaller units, 1 or 2 pieces, so that it suits the purpose. And also in terms of meeting the menstruators' needs of just purchasing 1 pad or 2 at a price of about 10 cents. As a startup, Wiseme has been facing challenges in accessing finances for operational capital, for research and development, amongst other things. So when we look at these 2 models, they're really promising. Both of the companies have been in the country for just less than 3 years. Wiseme is 3 years into the country. Actually, it's a local enterprise, and Kasha has been operating in Kenya for about 2.5 years. The market is warming up to these innovations, but there's still a lot that needs to be done. And this need to ensure that whilst they are really promising within the making sure that the urban menstruators are served well, what needs to be done to make sure that these innovations can also be scaled up to the rural menstruators that are really underserved. So for more information, I think the full report has more information on Kenya. Thank you very much, Nayantara, back to you.
Great, thank you so much, Maria. That's really interesting and to learn about these 2 organizations in Kenya. Over now to Tanya, who will talk a little bit about pad machine manufacturers in India.
Thanks, Nayantara. So pad machine manufacturers, this is something that Chris alluded to in his part of the presentation, where a lot of the access-driven initiatives are through investments from governments and donors. And so a lot of access models have focused on establishing small-scale production units in India at the last mile, which has led to the emergence of this ancillary industry, which is basically production machine manufacturers. There are about over 20 companies who are doing machine sales only in India, and majority of them are just pure play fabricators. So they just make the machines and sell them on trade platforms. Some of them are social enterprises like Saral Designs, Akar Innovations, Vatsalya, etc. And they also offer sort of value-added, services to their buyers. And these buyers are primarily NGOs and community-based organizations who are installing and operating these small-scale production units. So they support these units with services like bulk sourcing of raw materials, technical support with the facility layouts, operation maintenance, ongoing R&D with the product. And many of them also have a franchisee model, not many, a couple of them have a franchisee model where they buy back the excess production under their own brands. So given that these are social enterprises, they are primarily supported through grants, grant funding. However, the machine manufacturers themselves have a pretty viable commercially viable business because they are a cash positive business. An NGO or whoever is installing a small scale production unit, they have to pay upfront for that unit. While the unit itself is not cash positive, it's cash negative. They have to wait to set up the unit, get it running, do demand generation for the revenue to come in. So the overall profitability of machine manufacturers is higher, but their buyers and their market is not so great. This model has come up, like I said, because there has been sort of this effort to mix both creation of access at the last mile along with livelihood generation for women who would work on these units at the last mile. However, lately, the last couple of years, we are seeing some changes in the way this model is working because the commercial viability of this model is turning out to be a little challenging. So typically how it works is that a donor would be funding the machine costs for an NGO, and the NGO would install the machine, and then they would, keep on sourcing additional donor funds to subsidize the operational costs, which is obviously not sustainable. So what now machine manufacturers like Akar and Saral Designs are looking at to promote higher efficiencies is to look at a model where there are automatic machines which are operating at a higher production efficiency and are operating at some sort of a hub and spoke model. However, these are much more expensive, so they're almost 50 times the cost of a manual small scale production machine. So then, obviously the viability for the buyer goes down, and there are much less number of smaller donors willing to put in that kind of money, to establish that infrastructure. However, this would lead to an increase in efficiency, and there is a move towards exploring that from the social enterprise sector. Yeah, that's all for me, and happy to take any questions on this later if there are any.
Great, thanks so much, Tanya. And we'll just spend the last couple of minutes over to you, Jennifer, to talk to us a little bit about product entry and registration challenges in Nigeria.
Thank you so much, Nayantara.
Jenny, you may be on mute.
Okay, hello, you can hear me, right?
Yes.
Okay, thank you so much. So I am Jennifer Amadi from Nigeria, and I'm happy to share with us barriers to market entry, such as product registration. For us in Nigeria, the National Agency for Food and Drug Administration and Control, NAFDAC, has the responsibility to regulate and control the manufacturing, importation, exportation, distribution, adverts, including sales and use of consumer-based products, including menstrual health supplies. So this means that for new menstrual health products to make inroads into the country, there must be NAFDAC registration and approval, regardless if the products are imported or locally manufactured. So for local products, it is required that the product gets a trademark, which can be gotten from the Corporate Affairs Commission. So these additional steps aside NAFDAC. So at the point of key informant interview rounds with major stakeholders on menstrual health products for Nigerian assessment, there were recurrent mentions of challenges and difficulties around product registration, approval, inflation, and tax challenges. I heard clearly from both foreign and local manufacturers some level of difficulty they had to face to obtain NAFDAC registration. For manufacturers, NAFDAC registration and approval gives legal backing to put the product in Nigerian market. And of course, trademarks allows them to patent their products, for less possibility of counterfeiting. So according to my key informant participant, the registration process, was both time consuming and costly, which they attributed to a lack of clear relevant policy regulating and standardizing menstrual health products in the country. So even when NAFDAC and trademarks is achieved, local manufacturers have to face other challenges such as environmental health clearance and product packaging. So beside NAFDAC registration challenges, there are other barriers that inhibit market entry, such as inflation and taxes. Somehow, for manufacturers and distributors of disposable, and including cups, tax and inflation do not seem to be, for manufacturers of disposal, tax and inflation do not seem to be something of great concern, howbeit the effects of those taxes and inflation directly reflects on the prices of the products. Whilst cups and reusable products, distributors and wholesalers were grossly consigned, maybe because the products are still building on their consumer-based line. So for Nigeria recurrent inflation rate is said to be stabilizing according to our government, but when compared to the present cost of living, including buying menstrual health products, it is difficult, for us, for citizens, or should I say for menstruators, to believe the narrative of stabilization. And also taxes and import duties show some sign of swings above regulations. So with all of these layers of impediment put together, menstrual health product market entry into Nigeria at the moment seems quite Herculean task. But with strategic plan and smart thinking, one can still overcome such barriers. Over to you, Nayantara. Thank you so much.
Great, thank you so much, Jennifer. And to all the country consultants for your work on this and for your inputs today. Much appreciated. I know we only have a few minutes, so I'm going to jump right into trying to have us answer some questions that have come in on the chat group. We'll begin with a question from John. What innovations are emerging in the disposal of menstrual products? Has there been an effort to look more comprehensively at the disposal of reproductive health products and their environmental impact, particularly in developing markets?
And this is Lucy. Thanks, John. Disposal is certainly a question that has come up quite often. And we did see some innovations in products that are more environmentally friendly. And we do recognize that most countries in sub-Saharan Africa and Asia do have generally weak waste management systems, and investments to build those systems are needed. However, we didn't feel it was appropriate to place the burden of managing waste on the shoulders of individual menstruators. And so while bringing attention to the environmental concerns associated with the disposable products may help menstruators make choices about their individual product needs, we also have concerns that bringing those to the foreground have potential to further limit access, as we saw several examples in which full product choice has been limited because of environmental concerns. So we really believe that ensuring menstruators have a broad range of menstrual health product types and brands will not only decrease pressure on individual products to meet the diverse needs and preferences of menstruators, but it also alleviates the environmental pressure of disposable products. So the more information, the more choice, menstruators will choose a diversity of products that meets their needs. That's basically how we've addressed disposal within this report, is to say we really just need to ensure full access and choice of products. And I've been trying to
Great, thank
answer several other questions in the chat. What else? I'll hand it back over to you though. And are there other questions that have come up?
Hi all, this is Chris as well. And as noted in the chat, we will aim to any other unanswered questions. I think we've handled most of them that aren't answered. We will be sure to get back to you through email. But please do reach out to us with further questions, clarifications as you review the report and other issues come up. Be happy to answer and engage further.
Yeah, and it seems like we've just actually lost Nayantara. Siri, though, I do see a question. I think you were asking about products that don't disclose their components or quality control. And we didn't, there's so many different e-commerce platforms and so many different ways that their products are presented on those e-commerce platforms. We didn't get into the details of how quality and transparency is addressed on those, as I think it really depends on if you're looking at a platform like Kasha or one like Jumia. You know, how big their reach is and how focused they are on health products.
But just to add on to that, most of those e-commerce platforms would be compliant with the existing standards and regulations within the country, which we know are insufficient and deficient in some cases. But to that extent, they are playing at a level playing field of other distributors in the country. So we wouldn't expect them to be any worse than other modes of distribution.
And Samia, yes, I was on that NERC call yesterday about terminology. And I think because this is a young field and people are coming from really different sectors to menstrual health, that we get a lot of differences in terminology. And so I think it's really just clear that we explain what we are talking about when we're talking about it, the way that I tried to explain which products that we were talking about today, and Adrian explained which products that he was talking about. There's not agreed upon definitions at this point within the field, even on is it menstrual health or menstrual hygiene or menstrual health and hygiene or menstrual hygiene and health. It's an ongoing challenge. And I see that we just have 1 minute left. We have somebody who will close.
Yeah, thanks everybody. And thank you, a special thanks to Lucy, Chris, and the team from Man Global Health. Really a great presentation, a great report. I hope that everybody saw the in the chat, there is a link to the report, which is on the coalition's website at rhsupplies.org. You can take a look at that. It's on the front page of the site, and you'll get much more information, deeper dive into all the information you heard today. So thank you all for attending. It has been a pleasure, well worth a little break from my vacation. And again, heartfelt thanks to Man Global Health for this analysis. It's going to be a great resource for the community. So appreciate it, everybody. Take care. Have a good rest of the day, and au revoir. Thanks.
Thanks, everybody.
Thank you.
Thank you. Great to see so many faces on here, or at least names.